Come and enjoy a straightforward, humorous, and enlightened hour on quantum physics to metaphysics on the show that wants you to ask questions. It's time for Ask Patti, live with your host, Patti Conklin.
Hi, folks. It's Patti Conklin coming to you from beautiful Stone Mountain, Georgia tonight. And as always, I have my wonderful co-host here, Fernessa Hall, MD, da-da-da-da. Hi, Fernessa.
Hello, it's good to be back. I actually did miss last week.
You did, and Pam Thompson did a wonderful job with being interviewed, and we're going to kind of continue that, but you were up in Boston for your, I'm going to say it, your 25th Harvard reunion.
Oh.
Harvard, 25 years as a graduate.
Yeah.
But you had a great time.
I had a fantastic time. And if anybody has a chance to go to the Harvard Magazine website, sorry about that, J.K. Rowling, the writer of Harry Potter, gave the commencement address. And it was inspiring. And so if you go to just Google on Harvard Magazine, go to their website, they have a video and an audio cast.
And because you guys were the 25th anniversary graduates, you guys got to sit up on stage?
Yeah.
Wow.
We're special.
You're special.
We're old. That's all.
Well, we're incredibly happy to have you back, and we're very happy that you had a great time and that J.K. Rowling was so inspiring. So, yeah, she's really had a rags to riches story, and she's, the wealthiest woman in the world now? Or I think she's made it to the wealthiest.
She's only 42 years old.
Wow. That's awesome. That's awesome. Good
for her.
Inspiring material there.
Absolutely.
Yeah.
And her words were very personalized and heartfelt, and I think very timely for the graduates and for the rest of us that were in the audience.
Right. Wow.
So I hope people will go take a listen to it because it's worth the 20 minutes.
Google Harvard Magazine, and the lecture's only 20 minutes. So folks, set aside 20 minutes, and if it's a video too, maybe you'll see our Fernessa in there somewhere.
It's on her. So.
Okay. Well, last week, like I said, Pam had done a wonderful interview. I so enjoyed being with her, and she's going to be back next week as we continue on the whole topic of addiction for the month of June. And next week we will move into sex addiction and spend 2 weeks on sex addiction. But we're going to kind of recap a little bit of the drug and alcohol addiction last week. And I think one of the really important things that Pam stated, I mean, it was all good, but I think one of the things that just really resonated with me and people with addictions is when you're taking something out of you, like an addiction, you have to put something back in. And it's like when I talk to people about stop smoking. You've got to start a different behavior pattern. Go for a walk when you get the urge. Have some water when you get the urge. You've got to chew some gum. You've got to make a decision to fill something else in. And that was just really critical with drug and alcohol addiction. And we certainly were encouraging people if they have an issue or they think they have an issue.
It's interesting you say that because I went to the James Taylor concert here a few weeks ago, and everybody knows he had issues with drugs when he was much younger.
Right.
And he actually said on stage something about substituting exercise. He got into exercising and being healthy during that time when he was getting cleaned up.
Right.
And he's not had a problem for probably 25 years or more.
Yeah. It is so true. I mean, and Pam and I both agreed that an addict is almost always continues to be an addict, but they choose different activities that are more productive, whether it's exercise or cleaning the house or cooking. I mean, we typically go to something else other than addiction. And she had told me during the break of a story of a friend of hers who basically had a whole frequency shift when he gave up drugs. It was a whole frequency shift so that he was almost on the level of a monk, and became very non-judgmental and very just gracious and unconditional, and just totally had a radical personality change.
Wow.
And that's certainly possible. You know, that is certainly possible to reach that state where, you know, you're going to need to do that. So I think that it's really wonderful, really wonderful to be able to look at, you know, what's going on in your life and really make a conscious choice about what you're going to trade off. We've got a caller, so I want to go ahead and take that as we continue into the topic. So I think we have, your screen is really
Barbara
tiny.
Montana.
Barbara, Montana. I'm thinking I need some glasses here. Hi, Barbara.
Hi.
How are you?
I'm fine. How are you?
Doing wonderful. What can we help you with tonight?
Well, I've never called in before, and I thought I would call in and see what you do.
See what I do?
Yeah.
Do you have any specific questions?
Not really.
Pardon?
Not really. I don't have anything specific
Okay,
to ask.
I'm gonna do the 1 minute skivvy then, and then we'll see where we take it from there. But the 1 minute skivvy, the only thing that's standing out in your body is your right kidney, and it really is pretty congested. Do you get enough water?
I try to drink a lot of water.
Okay, trying and doing are two different things. So make sure that you really are drinking lots of water and really flushing that kidney out a little bit. And the other thing that I'd have you do is maybe even a kidney detox.
Okay.
Because, like I said, that right kidney is pretty congested. Lymphatic massage would also be something good for you because, you know, with the kidney kind of backing up there, it makes circulation slow down a little bit. So look at that, but your heart looks pretty decent. Liver looks decent. Left kidney looks good, just that right kidney.
Okay, and
Okay.
So my chest looks good and everything? Because I
Your
just
chest?
recently quit smoking.
Yeah, no, your chest looks good, and you know, it doesn't look like it's got any issues going on. Again, I do some lymphatic massage and see about doing a kidney detox, and, you know, congratulations on stopping smoking.
Thank you.
Just work with that, and just as we said earlier, you know, make sure that you're filling something in so that when you do get stressed and so on, you've got something else to turn to. And
Right. I've already had that experience. So
Yeah. Well, you know, it's we get so used to pattern. We get so used to a pattern in our body. So whenever we're changing a pattern, it's called reprogramming. And when we get into a reprogramming, we have to give ourselves something else to do. And a lot of times, you know, people smoke because they need a break from the situation, and it gives them an excuse to, you know, get up from the desk and go outside, or, you know, leave the kids and go outside for a few minutes. We're usually wanting a break, so give yourself permission to take time for you.
And what would you suggest on how do you flush your kidney out?
Well, you could, I think probably some burdock root would be good for you, or milk thistle, one or the other. Vanessa's saying, no milk thistle. All right, we'll go to burdock root, which is the first, and she's nodding yes. Go with some burdock root, okay?
Okay.
All right, thanks for calling in.
Thank you very much.
We appreciate it.
Uh-huh.
Okay, bye-bye. All right, cool. We haven't gotten a phone call in a while, so that's nice. We'd love for you folks to give us a call and join us and ask these questions, because it is, after all, Ask Patti Live, and it's Ask Vanessa Live, and we'll change our title there. Ask Patti and Vanessa Live.
You know, I talked to Pam yesterday. You know, anticipating doing the show
with her. Yeah.
And one thing that she brought up that it didn't sound like you all touched on very much was the typically people who have addiction have enablers in their lives.
Yes, and that's right.
That help, that, you know, for whatever reason, enables them to continue with their pattern.
Right.
So it's interesting because she was watching a show called Intervention.
Yes, I've watched it.
There was a man who was grown, who had problems with, I don't know, drugs, I think. And his mother, this has been years that he's had this drug problem.
Yeah.
He said she was astounded that his mother was weepy and tearful about this.
Right.
After years and years of him doing all sorts of things that addicts do.
Right.
And the guy was still living at home. And she just said, you know, it just struck her that this woman
was so enabling.
The enabler.
Right, absolutely.
You know, and how profound that relationship is in addiction.
Yes.
And we were going to talk more about that. So I'd like to throw that out and let's maybe you know, not just talk to people who are addicts or people who are family of addicts, but
the enablers.
Yes,
the enablers.
Because that's part of the pattern, and you probably can't find an addict that doesn't have 1, 2, 10, 20 enablers.
And the challenge with an enabler is realizing that you're enabling, because so much of the time I'm you know, somebody's got to support them. I mean, somebody's got to, you know, let them know that they're loved and let them know that they're cherished, and you know, move into that. That's a wonderful point. I remember, and this, as you were saying that, it just struck me. About 6 years ago, I was teaching a class in Hawaii, and there was a woman in the class, and you know, she just had a very sad face, just very sad overall. And I said, you know, so what brings you here this weekend? And she said, well, you know, I'm just trying to understand life. She had 5 children who all died of drug overdoses throughout the years. But when I pointed it out, she couldn't see where she was a part of any of it.
Wow.
And I thought, whoa, wait, 5 children, all of your children dying of different drug overdoses, cocaine, heroin, so on and so on. At some level, you have got to be a part of this. You know, there had to be, and the last 3 had lived with her, you know, as they slowly died away.
Well, there's something clearly in that dynamic, that family dynamic.
And she just felt like the kids, you know, maybe she should have been tougher with the kids and so on when they were littler. And I'm thinking you should have been tougher with them as adults. I don't think she ever really got it, that she was the enabler of that situation. And, you know, even dear friends of mine who are going through, you know, different situations with alcohol and drug abuse, when I point different things out about why did you give on this or why are you allowing this, they're like, well, you know, I just don't want to be an idiot about it, you know. I mean, you know, I still love the person. It's like, yeah, but by the same token, you're enabling. You're enabling by not saying, you know what, this is not okay.
Right. And it's hard. I think it's difficult because confrontation
is a huge issue.
Huge issue for many people.
Yeah.
Many times the addict has become very refined, very well skilled,
and lies very well.
Well, yes.
Yeah.
And they can press the buttons, the sympathy button, the oh, you owe me button,
the guilt button.
Exactly.
Yeah,
and
absolutely.
So, you know, I think anyone who has an addict in their life really should look into Al-Anon.
Yeah.
Really, 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 because it will give them the perspective to be able to more effectively set their boundaries, understand where their boundary is, and understand the critical need for them to set the boundary. And I don't think that, you know, that setting those boundaries necessarily forces the addict to change their behavior.
That's right. That's right.
I think that what it does is it forces the addict to recognize that they're not going to get to drive the bus.
Exactly.
And then then they can have a healthier relationship.
Right. Right.
I mean, you can still have a healthy relationship with an addict.
Right. Exactly.
You just have to know you're dealing with an addict.
Exactly. And having the boundary set. And, and one of the other things that's great about the groups are you really understand you're not alone. That as much as you're being manipulated or, things are being hidden in your home, it's so easy to think that that's the only home that it's really happening in. And, facing the fact that you've got a loved one that's an addict and realizing that there's other people out there that are going through exactly the same thing that you are and that there are guides and steps to get you, to help you through that. But, I got to say, as a mom, I mean, that's one of the hardest things is, laying down the law, setting the boundary for your kids because you don't want to be mean, but you want them to understand. And if you let the pattern continue into adulthood and they do begin an addiction, boy, you're in trouble because you've set up such a history of behavior. And I'm very fortunate, knock on wood, that none of the kids had addictive qualities or personalities, considering there's addiction personality in my family, and I was always concerned about it jumping the generations, doing the every other generation. I think there are some studies that have come out that kind of show that you may be the child of an addictive parent, but not have any problems, but your children may. So that's kind of interesting, and that just brings up the whole new level of having a parent as an addict.
Right.
Well,
it also brings up, if your parent was an addict, then what residual do you carry into adulthood and into parenthood?
Absolutely.
And so if you're the child of an adult child of an addict, then you probably need to go to Al-Anon too, because you probably never explored how that affected you as a child. And as you know, of course, those things don't go away. They're stored in your body.
Absolutely.
And certainly they will influence your behavior subconsciously. Unless you address them, deal with them, and move through them. So, and it might just be that
she's got her finger going, folks. I got to tell you, she's got her finger pointing at me.
It might just be that those stored memories and relationship issues influence how you parent. And influence the child. Maybe, and this is speculation, but maybe that influenced the child somehow. If the child has an addictive personality, to be more likely to become an addict.
I think without question. I think that children of, and I think that there's been a lot of books written about it, and with good reason. An adult child of an addictive parent or alcoholic parent, is that one of the things that I've noticed personally that I really had to work with, with my kids just in raising them, is with it okay to be saying no. I think that a lot of friends that I have had throughout my lifetime who had addictive parents, boundaries are really hard to set. Saying no is really hard. Confrontation is about impossible, to sit down and have that conversation that has to be done. And I've always said, I always felt like my children raised me because they were so wise beyond my ability to really articulate things. And so, when they were very young, I think it was Matthew that we had an altercation. He wanted to go to a football game or something like that. It was junior high school, and I said no. And I had a busy day, and I just, no, I'm not going to deal with it. And I'll never forget him knocking on my door at 11 o'clock at night and saying, Mom, would you mind coming out and talking to me, because I'm really not sure we listened to each other today. And I remember going out and kind of looking at him and sitting down and going, okay. And you know what? Across the board, 80% of the time when the boys did that, they were right. I was so rushed in my world, I just didn't want to hear what they wanted to do or their reasoning behind it. And that taught me a whole different level of how to interact. Now, had that situation not occurred, I probably never would have reached the state of being okay to sit down and discuss uncomfortable topics.
Right. Well, and if you're a child of an alcoholic parent, you may never be comfortable.
And never recognize that it's the alcoholic parent, the patterning that was taking place when you were a child. So, I think that's really important. And also, it's probably why we see such a continuation of addiction from parent to child and children just moving into it. Because for me, an addictive personality is someone who can't deal with reality, who can't deal with what's taking place and needs an escape at whatever level. I don't believe in partial addiction. You're an addict or you're not an addict, but you've got different levels of what you can cope with and what you can't cope with. And, that's a really clear signal. How are you communicating with your children? Are they starting to use, whatever early? Watching the signs, and how much are you, adding to their situation? Because the thing is, it's about kids. They watch everything. And I don't care how much you think they're not watching or they don't know that you're doing something, they know.
Yeah, if you're stoned, they know.
They know.
You're drunk, they know.
Yeah, absolutely. They're not stupid. They may not bring up the topic, but they know.
They might. I mean, I know with alcohol, because it's so ingrained socially in what we do. I have a friend whose son thinks she's an alcoholic. Now, this is someone I've known for almost 30 years.
Yeah.
And I would say that there may have been periods of time when she drank too much occasionally.
Right.
But at least when I was around her, never experienced where she could not stop, where it interfered with functioning, where it was an everyday had to do it thing. But her son, and she told me this, that he would come home late from a date or whatever, he would be asleep on the couch, and he would assume she was just passed out drunk.
Oh,
when what he was doing was waiting up for him to get in.
Get in, yeah, which we have a tendency to do.
Right.
That's right, yeah.
And so there can be some misinterpretation, whatever, going on as well.
Yeah.
And so now you've got a kid who thinks his mother's an alcoholic. He probably isn't, but
borderline enough where the son is concerned.
Right. However, now there's this extreme reaction where he doesn't drink at all, doesn't want to be around people who drink, and blah, 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 which I don't think is healthy
either.
And it's sort of like, okay, you need, both of you probably need some help, certainly communicating. But I see this young man, I'm thinking, well, gosh, what's he going to do when he has kids?
Right.
When he's got this very rigid notion.
Right.
And I think, I don't have kids, but I think the one thing I've learned from my friends who have kids, you can't be rigid.
Right. You have to be.
It doesn't work.
No. You have to be flexible.
I'm concerned because
the next generation. Yeah.
Because his father was an alcoholic.
Yeah.
But his father, they got divorced when he was small.
Uh-huh.
So, he was in a household at a very young age, and I'm wondering how much of this reaction is subconscious memories of what went on when he was very small.
Hold that thought for me, because I do want to continue this when we pick up on the other side of break, because I think it's really important.
Time already.
Your computer is really tiny, but I think that it's break time.
It's break time.
So, folks, we'll see you on the other side, and we'll be back in just a minute. Thanks so much, folks, for being a part of the show tonight and listening as we continue on with our topic for the month of June about addictions. And we're discussing drug and alcohol addiction, and next week we're going to be moving into sex addiction, which I know is kind of a rough topic for people, and we're going to have Pam Thompson coming back to join us to discuss sex addiction, and then we'll follow it up the following week, because there's so much of behavior that is based in how we perceive addiction, either our own or for those around us. And you were talking about your friend's son who became so rigid in not wanting to be around alcohol and so forth. And I was sharing with you in the break that when I was in high school, back in the early 70s, everybody was doing everything, it seemed like.
Yeah.
And I was so rigid about it. I just always said, and I was part of the rough gang. I was not a nerd, and I was not a goody two shoes. I was pretty much part of the motorcycle club. But if they were having a party, I would say, if you want me there at the party, you can't do drugs while I'm there. I don't care if you do them after I leave, but I will not show up if you're going to do it.
And where did that come from?
Well, it absolutely came from childhood, that I was so scared as a teenager. I was so terrified that if I ever touched pot or ever touched alcohol, that I would never be able to get beyond it. I would never get off it, and I would have a lifetime. I mean, I could just see a lifetime of never getting beyond alcohol or drugs.
Oh.
And that scared me enough that not only did I never try it, but I wasn't going to be around my friends who did.
So when you were growing up, was there an alcohol issue?
Alcohol and prescription drugs. And so, both parents had their own addictive personalities. Now, fortunately for me, nice personalities. I mean, very a passive alcoholic, somebody who
sit around and get drunk
and fall asleep, but never a harsh word, never any meanness, anything like that. Not all the family members like that. Some were incredibly brutal. So I watched that as a child, and so when I started hitting that age 10, 11, where I was moving into the time of my life where kids were experimenting with pot and so on, it absolutely terrorized me. Absolutely terrorized me, where I couldn't even begin to fathom doing it, nor could I stand being around someone who did. Now,
sort of an extreme reaction,
absolutely,
based on childhood experiences.
Exactly what you were saying.
Reinforces what I'm thinking is going on.
And so then, as I moved into my 20s and so forth, I got to the point where I recognized, I loved beer and I could have my A beer. And I remember you and I talking about it at some point last year. I think you were doing a checkup or whatever, and I said, I love to have, my A beer at night or a shot of whiskey. Do you think I've got, do you think I should watch that? And I just remember you looking at me and bursting out laughing, and you're just kind of like, no, I don't really think it's an issue with you. And it's not, but it's obviously, even
I've
at
never
50.
Seen you intoxicated.
No, in all the years you've known me.
I really can't remember.
No.
Maybe once, maybe, but
maybe.
I can't.
Maybe, yeah. But it's not something that I typically do. But obviously, me just even asking the question,
Right.
even at 50, there's still something in the back of my brain that says, be careful, pay attention, that.
And that's, I mean, it's wise to be mindful
right.
of what you're doing. Reminds me of when I had my regular practice, and I was stressed to the max, and I would come home and I'd have a drink of something. And I remember coming home like 3 days in a row and having a drink, and then I scratched my head and I said, I bet this is how an alcohol problem begins.
Yeah.
And so I decided that when I had a good day, I would come home and have a drink. There's no way I would ever have an alcohol problem because I didn't have enough good days.
Good days to make a difference.
Exactly.
Yeah.
But I had that conscious thought of, like I deserve a drink because I've had a tough day.
Right.
And then I can see how that can just, innocently, somewhat.
And throughout the years of knowing you, I see you every once in a while with a shot of Bailey's Irish Cream, which you can't even really, I don't even really consider alcohol, but that's like
it's
the extent. It's nice and sweet, which is what you like. But it really is amazing on how much of it is programmed, and that we're not even aware of the decisions that we're making today based upon what was going on in our lives younger. And
I mean, I've got to say that my parents, I think I saw my father really, really, really trash once.
Yeah.
I mean, like blank face.
Right.
And but I've never saw him intoxicated before or since.
Yeah. Yeah.
But my parents, they would drink alcohol occasionally at dinner.
Right.
And it would be 1 or 2 drinks.
Right.
And they would let us taste it.
Right.
And, my sister and I would taste the whiskey my dad drank, and it was so disgusting. We're thinking, how could you possibly drink that?
Right.
But allowing us to taste it took the mystery out of it.
Right, exactly.
It was like, this is nasty.
Which is what I really did with my kids, as they got to be later on in their teens, to have the taste of it and just experiment. And, Daniel just never went there. I mean, he just alcohol, drugs, no, thank you. I just not even interested in that. But I think that when we look at the patterning in life, I think it's really important to do that self-analysis of, am I reacting? Am I not reacting? Everybody knows who's in a lecture with me. If I'm pulling from a lot of people, if I've got a big audience or I'm teaching all day, when I get done, I want a beer and I want a steak. And typically a Guinness, something that's really rich, that's got a lot of nutrients in it. And that was going to be my next point, that, in a lot of places in Europe, pregnant women, they recommend that they drink 6 ounces, 4 to 6 ounces of Guinness every day during their pregnancy.
Those B vitamins.
It's the B vitamins. It's so rich in that it's, anything else is too much.
Well, but there are better ways to get that, but...
Yeah, but, it's you go to a good pub in Ireland and you've got some good Guinness coming through. But I think that it's, we all have to be aware of what takes place. And I certainly sat down with my kids as they started reaching an age where I knew that they would probably begin experimenting, because they didn't have the experience I had. It wasn't, oh my God, I don't want to go near this because I'm afraid I'll lose control. They didn't have that experience. They didn't see their mother with alcohol or with prescription drugs or acting out or anything like that. Yeah, they had a weird mom, but not because of stuff. Yeah, right. But I think that it was even more important for me to have that discussion with them to make sure that they were aware of the consequences of drinking too much. And certainly it has hit home to them in many different ways within our own family. Yeah. So what are different groups that people, I mean, certainly enablers and people who are living with an addict. I mean, an addiction doesn't make a person less lovable. I mean, they're still beautiful people. They can be absolutely wonderful people.
Were addicts.
Yeah, absolutely.
A lot of fun, life of the party, blah, 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 and then they cross that threshold.
Yeah.
But, yes, it's not I don't think it's I think so often people are judged as being bad people when they're an addict. Now, there are plenty of addicts that do bad things.
Right.
I also think that there's maybe not as much compassion for people with a drug or alcohol problem.
Right.
I think it's perceived as a character flaw. Oh, you're just weak.
Instead of a disease.
Instead of being a disease.
Yeah.
Being an actual physical addiction.
Right.
And I think that's a problem with our society. And I think that's a problem that makes it have so much shame and so much more emotion wrapped around it.
Right.
Which then makes it harder for people to come out and say, I have a problem.
Right.
Because of all the shame associated with that.
Right.
And, the gee, I'm a bad person stuff, which, we say that to ourselves enough as it is without having an addiction. Without
having other people. But, that in going back to what we were talking about earlier in being an enabler, people, in order for most, I'm saying most, and I probably shouldn't be, but I think for a lot of addicts, in order for them to really be able to admit that they have an addiction, they have to hit rock bottom. And that means the people who love them need to back away and put some distance and let them fall. Easier said than done. Wow. Easier said than done to sit and let somebody fall and have to deal with watching them in pain and watching them go through all of the steps that they're going to have to go through in order to be healthy again. But it almost always has to happen.
It does seem that way.
It does.
Oftentimes. Or the person just gets it and makes those necessary changes. But I think that, it's in our nature to help people.
Yes.
We want to help. We want to make it better.
Right.
But I think this is one of those situations that you really can't help.
Right.
You can support in the sense of, I love you.
Right.
I'll take you to your
appointment,
your appointment, or I'll help facilitate getting the care you need.
Right.
But it's one of those, you take 2 steps, I'll take 1.
Right.
Kind of deal. It's not, let me take you to something. It's, you call me.
Right.
If you need a ride to such and such.
Exactly. I'm not going to call you daily and see if you need a ride.
Exactly.
And that's a big difference.
And that's a huge difference.
Yeah.
But a lot of people wouldn't see that as a difference.
Right.
And, for instance, this is unrelated to addiction, but I've had people call me and want to make an appointment with me for their spouse.
Exactly.
And I'm like, does your spouse want to see me?
Right.
And they're like, well, he knows he needs an exam and blah, 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 blah. And I'm like, you know what? Why don't you have him call me when he wants to be seen?
That's right.
Because what I've found is they're not engaged in the encounter, and they just do it because they're like, okay, she made me, and I'll do it and shut her up. And then the encounter I have with them is useless.
Exactly.
So I want to see that person making the effort.
Yes.
And I think it's the same situation with the addict. They have to initiate things.
Right.
It can't be, oh, call me at whatever time and wake me up so I can make it to my meeting.
Right.
No.
Right. No.
You wake yourself up.
Yep.
You can't wake yourself up with an alarm. I mean,
Right.
So that's
right.
basic.
You take care of it.
12-year-old can do that.
Okay. And you know, we're going to hold on that thought for a minute because it's time for break again. It's time for break again, and then we're moving into the last 12 minutes. But, yeah, let's go ahead and hold that thought, folks. Think things through, and we'll see you again in just a minute. Hi, folks. Thank you so much for joining us tonight and being with the show. We just always love to have you listen in and get your input. And all of you who are downloading to iPod, we love that. And you can always give us a call and make an appointment. You could actually have a one-on-one. And you can contact Vanessa at mobile-medicine.net. And she does a lot of work over the phone, so she can work with you on whatever it is that you're dealing with or point you in the correct direction if she can't. Or you can contact me at pattyconklin.com, and Patty's with an I, and or you can make your appointments online at the website, pattyconklin.com. I want to go back to what we were talking about prior to the break because, you know, I know that I have a rule of thumb that I only allow people to call me for any specific one incident 3 times. That's it. I'm not going to let them call me every week or every 2 weeks over the same problem. My feeling is if I've given you, you know, an understanding of where the problem is and I've given you homework to take care of it, it's your responsibility. And I'm not going to let you keep hanging on to me because, you know, we've all seen, and you probably have seen, workshop junkies, you know, workshop addicts who come to workshop after workshop, the latest thing, the newest thing, and but they never make use of what they learn through.
I've had patients like that.
Yeah.
That had been seeing one doctor and did their program, decided they wanted to switch, finally got to me.
Yeah.
Then they wanted to switch to someone else and all this stuff. And it's like, you know, the main problem here is that you're not following through to completion. You do halfway, and then you're not seeing results, which you've only gone halfway.
Right. Right.
You know, so you've got to finish this. And I sometimes think it's, you know, that is what enables that person to remain
exactly
sick.
Remain
there's
sick.
Some secondary gain from not being well.
Well, look at how many prescription drug addicts jump from doctor to doctor to doctor to doctor because, you know, I've got pain here, and the doctor catches on and you know, stops the supply, and then they just go to another doctor. So you have...
Not that they don't necessarily have real pain.
That's
They're
right.
not willing to do the things necessary.
Exactly.
Take a pill. To address the thing.
And so they'll just, you know, whether they get addicted to OxyContin or whatever. But my flag always goes up when someone calls my office and says, I want to fax to you all of the readings from other psychics that I've had. And that's just a huge flag. I don't have any interest in knowing what somebody else said. You know, I'm going to give you my skivvy, and that's what it is from where you are today. And it's immaterial to me about what's been going on in the past.
Right.
So
people can be addicted to all sorts of things.
Sorts of different things.
There are people who aren't necessarily addicted to pain meds or anything, but just have to go to the doctor for everything.
Yeah.
And you scratch your head as a practitioner and think, why are you here?
Right.
You know, what is behind this?
So it's confession time on my addiction.
Chocolate?
That's your addiction. My addiction's Stargate.
Oh, well, yeah, that's sure. Every time when we're at your house doing the show, which we're at my house today.
That's right.
Stargate is always on.
Stargate's always on. Stargate is like the bomb. It's like, and even
like
when I'm...
Alien versus Predator.
Alien versus Predator, or Lord of the Rings, yes. Alien versus Predator, Christmas Day. Yeah, you're never going to let
Alien
me live
versus
that
Predator
down.
2 is horrible.
But it is my release. And so Alien versus Predator or Stargate. So that when I'm on the road, I take my disc with me and take a selection.
Weird.
because if I'm in my hotel room or I'm on the plane and I'm stressed, I'm going to pop in one of my Stargates or what have you, and so that's my addiction. Chocolate's yours. You're the chocolate person. But we all have personalities that in one way or another shape. Obviously, personalities shape who we are, but we all have different things that we can be in the excess of. None of us are truly balanced. And so I think it's that, coming to terms with, you and the rest of the gang here want me to go see a chick flick one of these days. I'm really going to work hard to balance out. I mean, it's not something I've ever done, and I can't really imagine doing it.
You squirm.
Yeah, you guys are going to have to tie me up and make me sit there. But I think that we all have to look at what's really taking place. And,
Gary says he loves his Stargate.
Oh, Gary, yay!
I do.
I don't know how the world existed before Stargate. I'm absolutely serious.
I've got the complete series at home.
I do too.
Yeah.
I do too. Single one of them.
Somebody call in and save me.
Someone pour water on us.
Yeah, really. It's just, I can't leave home without it. It's one of those things, I don't need drugs to leave home, and I don't need any beer to leave home, but I can't leave home without my Stargate.
Okay.
So, yeah. Well, we'll have that. But we really do all have situations where we can become excessive.
Yes.
And even exercise
just periods
addiction.
of time, where you're in a particular frame of mind or whatever, and you get sort of caught up in something, and then, hopefully you come out of it.
Right. And as Pam and I talked about last week is, hopefully you have friends who, if you're acting out or you've become excessive in one area, that they tell you, that they sit you down and now I would ignore you on Stargate. I would totally ignore you.
It's not harming anybody, so it's all right.
You guys just get bored with it.
That we really do need to be mindful of it, because ignoring something in your friend is harming them.
Exactly, and that's a great point with the whole enabling thing. You're not doing them a favor by ignoring it, and it's standing up for what you know to be truth for you, and maybe that's not truth for them, and maybe they'll ignore you. But, I think it's important for all of us to be able to, say, what, I really feel that this is an issue.
Right,
and,
or
it's affecting our friendship.
Right, well, I think that this might be a problem for you.
Right.
Maybe you should examine it.
Right.
Because maybe it's not a problem yet.
Right.
Maybe it's on its way.
Yep.
But that person needed someone to hold up that mirror and say, take a look.
Yep.
Because if you, if I didn't say anything now, maybe you would get to that point of no return where you're over the edge.
Yeah. And I want to get this in before we run out of time about groups. Because you can go, there's always different group programs within your community. Look them up, look at them. If you go to one and you don't really click, go to another. Understand that they're not all the same, and the personality dynamics are not all the same, and that it's just like picking a physician
or a
therapist or an intuitive
or
massage therapist. I mean, we either click with a person or we don't.
And now they have non-smoking groups. They have groups of all different sort of sub-segments of the population. And they have all these groups, and they're, most of this is free.
Right. And
you just have to get there.
Yeah, get to your community, and a lot of it's online anymore. I mean, a lot of support groups have got online sites where you can go into blog or chat and just, let people know that you're having an issue, just like we used to have we still do, but, the one support group that always seemed to be out there was suicide prevention groups, and where you could call in. But now with the advent of the Internet, we really have the capability to be in touch and reach out for people when we know we're having a problem. So I just want to give Fernessa's contact info one more time. It's going to be mobile-medicine.net and pattyconklin.com. And we will be moving into the topic with Dr. Thompson next week of sex addiction. So we hope you'll join us and continue on.
Sometime down the line, we're going to talk about anorexia and bulimia.
In July, hopefully. Yeah. So we've got a lot of topics we want to continue to cover with you folks. So we look forward to talking with you next week. Have a great night, great week, and we'll see you next week.